Go ahead.
All right, so I'm going to show a video how to make a metatarsal pad today. This is gold mine for any kind of Morton's neuroma or metatarsal stress fracture, any bunion, first ray issues, hammer toes, anything like that. So what you're going to do is you're going to get this orthopedic felt, this 1/4 inch orthopedic felt, this adhesive on one side. You can get it, I get it on Amazon. Get a roll of it, and you're going to have your patient stand on it. So go ahead and put your foot on it so your toes are almost off the end, and scooch this way so you're off the end that way too. Not all the way off the end, okay? So scoot back towards your heel, perfect. What you want is the first web space between the first and second toe. You want to be able to see that through the toes there. So that's the furthest edge of this metatarsal pad that you're going to make. And then we'll trace this. We're just going up to the end of the metatarsal on the fifth side. We're going to do something similar on the medial side. All right, go ahead and pick your foot up. So now we've got something that looks like this. Can you see it, Bree?
No, I can't.
Okay, so this is that point in the web space between the first and second toe. This is the end of the first metatarsal. That's the end of the fifth metatarsal. So I'm going to draw this line like this. It's going to be the beginning of our fifth metatarsal pad, or our metatarsal arch pad. We never push up on the fifth metatarsal. So even though I drew my line there, we're going to cut inside of that line something that looks like this. You have my scissors. Thank you. Okay, this is what we're starting with. So which foot did I have to use? This one. So scoot back. So now you're going to put this up to the foot that you're going to fit it to. Now remember I said we don't want to ever push up on any of the fifth metatarsals, so I still have some more to trim off there. We don't want to push up on the calcaneus. We're going to make sure we're just distal to the calcaneus, and we never push up on the head of the first metatarsal. So we're going to cut that out right there. Okay. All right, that looks pretty good. Okay, so the way I fit this is I put it on the shoe liner, right? We've got the sticky side up, so we're going to put it on the bottom of the shoe liner, and then they'll just wear that inside their shoe. This is the hardest part, is peeling this backing paper off. Maybe I should have filmed this. Okay, good. I cut it. I thought for a second I was going to have to go to commercial. But so anyway, we stick it on the bottom of the shoe liner. Looks like that. If your patient feels like there's an edge anywhere, you can just kind of trim off some of these edges. But this felt is pretty wimpy, so if they're able to wear it around for even 10-15 minutes, they probably won't feel the edges that they think they feel when they first start wearing it. Then you just stick that back in the shoe, have the patient try it on. If you want to learn more about biomechanics, interventions for all lower extremity pathology, please come to my website and think about either hosting or attending a course at thinkingonyourfeet.org. Okay, that's it.